Hey, what up guys, Ashin here from UCAT and welcome to section 5, Situational Judgment. Now this is the last section of the UCAT, and in fact they call this the non-cognitive section of the UCAT. It's actually not included in your final score, and there's a separate score that they only give to this section, section 5, Situational Judgment. Okay, now a reason why it's not scored the same, it's because this is not a logical reasoning section. Okay, they don't give you new information that you're meant to interpret and draw conclusions from. Instead, they're testing you on how well you judge a certain situation. Okay, now there are two question types, and today we'll be going through the importance question type. So with the importance question type, here's how it's worded. Okay, it's worded, how important to take into account are the following factors for Dr. Anderson when deciding how to respond to this situation. And if you take a look at the answer options, they are actually always the same. Okay, now the question itself will have a consideration. Okay, and then the answer options will be the same. Is that consideration very important, important, of minor importance, or not important at all? Okay, a reason why this is not part of the logical reasoning, sections 1 to 4, is that for situational judgment, the more familiar you are with the situations, the better you will be in order to make the correct judgment. Okay, so if you do questions and if you reflect upon, why a consideration is, either A, B, C, or D, very important, important, not important, or not important at all. Okay, even if you get the question wrong, you'll remember how to answer the question in a similar situation for the future. Okay, so if you do reflect on, any of your errors and then adjust how you judge a certain situation for the future, you will get better as long as you become more familiar with all the situations. And there's really not that many different types of situations. Okay, what types of situations will UCAT give you? Okay, it's either, you're in the healthcare profession. You don't necessarily have to be a doctor. Could be a nurse or a podiatrist. Okay, or you'll be still a student. And then it'll ask you how to, how to react, or how important are the following considerations for a situation in either, as a student or in a healthcare profession. Okay, so what exactly, will the situations be like that UCAT gives you? Now, they're not going to be too, difficult because you guys aren't doctors just yet. And, and doctors go through lots of training, professional training into what they can or what they can't do. So don't expect anything like difficult like euthanasia or other things like mandatory reporting. Okay, you don't need to know so many like guidelines, okay, in order to do these questions. You just need to be familiar with the styles of situations that UCAT gives you. Okay, now as a quick reference guide, these are the common mistakes that people make in which they just don't follow and don't make the correct judgment. Okay, it's literally, just these three main points. If you remember that the health of the patient and the community or your co-workers, that has to always come first. You can't put your patient at risk. Okay, you can't put your co-workers or the community at risk. Okay, all of your judgments in all of your situations has to make sure that health is put as number one. Okay, people often get these questions wrong because they don't put health as number one. As silly as it may sound, people just don't think deep enough to actually think, oh, am I actually putting anyone at risk? Okay, so if you think deeply about, is your decision actually putting people's health at risk? I know that's always one of the major things in situational judgment of UCAT. Okay, now the next one is make sure you're following hospital policy. So I'm not saying go read up on, all the policies that are in hospitals at the moment. But just take a look at the premise, okay, and it should tell you, okay, if there's any policy being broken. Okay, so you don't need to read up on lots of hospital policies, it should tell you what's being broken. Okay, one of the examples I put is patient-doctor confidentiality. Okay, this is pretty much the only policy you kind of have to remember, that you don't break confidentiality if you are with a patient, if you're their doctor. Okay, so other policies should be mentioned in the premise. Okay, and the last one where people do make mistakes in is talk to co-workers first. Okay, so in situations when you're judging whether a situation is correct or appropriate or not, just keep in mind that you should always be talking to your co-workers first, okay, before you actually like report them to a supervisor, before you deal out any punishment. Okay, make sure that there's good communication between co-workers. And if it's a minor misconduct, make sure you talk to the coworker first. If it's not minor but something very major, you still go and talk to the coworker first. Okay, these are the things that often catch people off guard in the UCAT. Okay, so that's the three things that people often get caught out on. Now, taking a look at this question here. Okay, if you take a read of the premise, there's always something questionable that's going on. Okay, so as you're reading it, you just take note of what those questionable things are. So in this case here, Dr. Anderson is supervising a medical student. As a med student is about to perform the procedure on a patient, she begins to panic and tells Dr. Anderson in front of the patient that she cannot perform the procedure. Okay, so she panics, and do take note that, so that's the first thing that sort of jumps out. Now, who's panicking? Okay, make sure you know the people that's actually involved in the situation. Okay, it's the med student. Okay, and she is panicking to Dr. Anderson. Okay, but that's not all the characters in this scenario. There's also a patient. Okay, she's panicking in front of a patient that she cannot perform the procedure. Okay, so that's the questionable part of the scenario. Okay, so Dr. Anderson knows that she's capable of performing this procedure as he has seen her confidently perform it before, and he is unsure why. Okay, she's unsure why she's suddenly feeling anxious about it. Okay, the patient appears to be unsettled by the medical student's behavior. Okay, so the patient is visibly unsettled. So that's something that's questionable as well. Okay, so after reading it, you should realize, what's questionable, who is involved, and you should actually already have an idea of what should be done in this situation. Okay, so ideally, since they're dealing with a patient, they have to make sure that the patient's health and safety is put at number one. Okay, so probably the doctor has to step in and make sure that the patient is not unsettled anymore, and then they can continue to perform the procedure and probably leave the med student out of it. Okay, and let Dr. Anderson do it himself. Okay, so that would be the ideal situation. Now, you might not know what the ideal situation is after you do your first few questions, and that's because you're not familiar with all the situations just yet. Okay, but after you do like 10 or 20 scenarios, you realize that the situations are kind of the same, and you realize what to do straight away, as long as you properly reflect on each of those situations. Okay, so if you remember, like the first 10 questions that you do, dissect it properly, what's happening, then you'll realize, after you do 10 or 20 questions, it's just the same scenarios over again. So hence, that's why it's not in the first 4 sections of the UCAT, but it's given a separate mark, a section 5 mark of the UCAT. Okay, so how important to take into account are the following factors? Okay, now the reputation of the medical staff amongst their patients. Okay, so here we are given an actual consideration, and we have to see whether this consideration is either very important, important, of minor importance, or not important at all. Okay, now a quick key to help us answer the question. So let's say here, if it's very important, it's usually relevant and it's immediately relevant. So this consideration is relevant to the situation and it is immediately relevant. Now, if it's B, important but not very important, it's still relevant, but it's just not as urgent or as immediate. Okay, so that's what constitutes a B. Sometimes it's really hard to separate A and B, in which case the difference is just whether or not it is immediate or like it's the consideration is something you think about and have to apply straight away or not. If you don't have to apply that consideration straight away, then it's probably B. Okay, now C and D you choose whenever the consideration is quite irrelevant. Okay, so for C, it's mostly irrelevant except in extreme cases. So that thing that you consider, you don't really think about it much except for extreme cases. And D, irrelevant, means that that consideration is completely irrelevant and it doesn't affect the way you respond. Okay, so it's something that doesn't affect the way you respond at all. It's completely irrelevant. Okay, so A, B, C, D is a little bit difficult to actually select the answer, especially for B and C. Okay, so if you haven't already, please have a go at these questions. See the consideration, use that key of very important, use this key in order to answer the first question here. But not just the first question, but all the rest as well. So just quickly press pause and see what answers you'll get. Okay, now if you've done the first two, here are the last two questions. Just press pause and please select the answer that you'd get. Okay, now going through the questions itself. Okay, so the first question says the reputation of the medical staff amongst their patients. Is that something that is relevant to this situation? And is it, immediate? Well, it's definitely relevant because you can see there's a patient here. So the reputation is being affected. Okay, and so when the doctor responds, he has to respond whilst keeping this consideration in mind because they're still in front of a patient. Okay, now, is it very important or important? Is it immediately something that he's thinking about, or is it something that is not so urgent and not so immediate? Okay, now in this case here, he is thinking about it. He should be thinking about it immediately because the patient himself is feeling unsettled. So if the patient has a bad reputation of the doctor or the hospital, then that would actually affect the patient's treatment, which would affect his health. So in this case here, it is immediately important, like I said before, because the patient is there and also the patient is feeling unsettled. So you don't want the patient to have to think that or to have a bad reputation. You don't want the doctor to have a bad reputation towards the patient because that will affect the treatment. So the answer here is A, and it's very immediate. Okay, now B, the student's academic progress. Okay, in this situation, is the doctor thinking about the student's academic process? He is not at all, because the student is the person, not the person, that's really important. It's the patient that's important, putting the patient first. Okay, because, they're performing a checkup, they need to make sure that the checkup is finished correctly and make sure the patient is not unsettled. So the student's academic progression, the doctor should not think of it at all in how he responds to the situation. Okay, now the next one. Okay, the emotional issues that the student may be facing. Is that relevant to the situation? Well, it's definitely relevant because, the student is feeling anxious about this procedure and he's voiced his anxiousness. So it's definitely affecting this situation. However, is this something that the doctor should deal with straight away? The answer is no. Okay, because the doctor is in front of the patient, he should deal with the patient first, okay, before dealing with the student. Okay, so the emotional issues of the student is definitely relevant. It's causing this whole situation. Okay, however, the doctor should not deal with that first. He should deal with the patient first, and then afterwards. So it's not something immediate or urgent, but then afterwards, then he deals with the emotional emotional issues of the student. Okay, and the last one, the fact that he has seen the student perform this procedure before. How important is that consideration? Okay, if you selected D, okay, well done. It's actually not important at all. It doesn't affect the way that he reacts. Okay, so remember each of the following factors. How important are the considerations when deciding how to respond? Okay, so the fact that the student has performed it, whether he's performed it before or not, doesn't actually, affect how Dr. Anderson should respond. Dr. Anderson, like I said before, his response should be to make sure that the patient is not unsettled. Okay, so to settle him down and to make sure that the patient is performs the procedure properly. Okay, so that the patient is looked after properly. Okay, that's the number one concern. And then his secondary concerns later on, yes, why is the student anxious about it and all that. However, that consideration doesn't actually affect how he should actually respond. Okay, so there we go. There's our answers. Now, if you select a very, very close answer, like for example, in the last one, a lot of people may select C, of minor importance instead. Do take note that you do get partial marks. Okay, and then your partial marks, if you're very close to the answer, you still get quite a lot of the marks. If you're very far away from the answer, you'll get very little marks. Okay, so do take note that partial marking is involved. So if you find that you're always just slightly one off, don't worry too much. Okay, just reflect, why you're slightly one off, and then apply that in future situations, and you should be all right. Okay, but if you find that you're very far off, then you do have to take note. Why is it you are really, really far off, and you have to change the way that you judge situations. Okay, now the way that they mark you is that you'll either be put into 4 bands: band 1, 2, 3, or 4. Band 1 being the best. Okay, and most people do get in band 1 or band 2. Okay, so as long as you get familiar with yourself, with the situations, and then choose an answer, and then reflect and see why your answer is different from the correct answer, okay, then you should be able to be very good at situational judgment after you go through about like 10 or 20 questions for each of the question types. Okay, so it's not a difficult question type. It's the best performing question type out of each of the sections. Okay, so just get familiar with the situations and you should be fine.